The South Korean health authorities have announced that they're slightly relaxing the social distancing rules to allow social gatherings of up to 8 people rather than just 6. Restaurants will still have to close at 11, though. There had been hope of the rules being eased more, but officials are concerned about the potential strain on the medical system caused by the ongoing surge in cases. Our Han Seong-woo has the latest.
South Korean health authorities have eased the country's social distancing guidelines to allow larger private gatherings of up to 8 people max, 2 more than the current 6. However, business hours for restaurants and cafes will not be extended to midnight from the current 11 p.m., despite public anticipation. Officials explaining that now is not the time, pointing to the recent increase in the number of patients in severe or critical condition.
It's time to modify the current social distancing scheme, but it's too much of a risk to drastically ease measures, considering the Omicron surge and the uncertainty surrounding its peak, as well as the strain on the medical system.
This comes as the government mulls over whether to relabel COVID-19 from a Class 1 infectious disease to a Class 2 disease. Despite some criticism from the medical community, officials have increasingly been comparing its fatality rate, 0.09% as of last month, to that of the seasonal flu. As such, lifting restrictions altogether was once considered a possibility, but those chances came crashing down over the past few weeks as cases soared into the 6 digits. The country reported its second highest daily tally ever of 407,017 new infections on Friday, 200,000 less than the all-time high set the day before, but another heavy addition to the total caseload, now at 8.65 million. An increasing proportion of those are less vaccinated teenagers and infants who haven't been inoculated at all. With 301 more lives lost, the death toll now stands at a little under 11,800. The number of patients currently in severe or critical condition, meanwhile, continues to be in the thousands for over 10 days now at 1,049. And to care for them better, authorities announced on Thursday plans to further concentrate medical resources on those most in need.
To efficiently allocate the limited number of beds for intensive care or special treatment, we will update suitability assessments and more actively relocate patients that are no longer isolating to different hospitals.
Health authorities are attributing the recent uptick in cases to both the adoption of rapid antigen tests for official purposes and the spread of what's being dubbed stealth Omicron. Han Seong-woo, Arirang News.